Coming up on Nursing Success TV. This month, Dr. Phyllis has advice for a nurse entering the social media space. We celebrate National Nurses Week, and we meet Nurse Educator Angela Owens.
Ask Dr. Phyllis is brought to you by New York Presbyterian Hospital. Amazing things are happening here.
Tim, an RN from Pittsfield, Massachusetts, writes, "I'm considering starting a blog on emergency department nursing, but friends are warning me it could have a negative effect on my career."
Tim, venturing into the world of social media can be an issue if you don't use good judgment. When you publish as an individual, the rule of thumb is to be sure that you don't post anything that you wouldn't want your grandmother to see or read. But when you post as a professional, the rules of conduct are a bit stricter. Keep in mind that you are bound to maintain HIPAA compliance. Divulging any patient private health information is a federal offense. Resist any temptation to discuss your professional colleagues online, especially if you're not going to sing their praises. And be aware that many healthcare systems have teams within their IT departments monitoring social media for negative comments about the organization. Mentioning your facility online may be a violation of your organization's code of professional conduct. Many nurses are successfully blogging on important issues facing the profession, and these posts discuss pending government legislation, current clinical challenges, and issues such as workplace violence. The key to a great blog is writing about engaging topics that provoke thought and invite respectful discussion. And if you maintain a professional tone, I'm sure you'll be a success.
Email your questions to AskDrPhyllis at nursingsuccess.tv. To celebrate National Nurses Week, we are excited to share that for 12 consecutive years in a row, nursing has been ranked the #1 most honest and ethical profession in the United States. Congratulations! One of our trusted professionals is Angela Owens. Angela is a leader in nurse education, the Associate Dean of Faculty at Chamberlain College of Nursing, and has been a nurse for nearly 15 years. Today she shares an important message to nurses at all stages of their careers.
I didn't think nursing would be a career that I could go into. I'd always been interested in it, but I was afraid that sticking somebody with a needle, that was my biggest fear. I hated to have shots, I hated to have my blood drawn as a kid, I hated it when they stick your finger. And so I thought there's no possible way that I was going to be able to do that to another person. So I didn't think nursing would be something that was for me. I took about 7 years to finally complete my BSN because I dabbled in a lot of other things. I took courses in physics, in journalism, in chemistry, but I kept wandering because I just wasn't satisfied with any of those. And then finally, my dad said, "Why are you holding yourself back? You've always been interested in nursing. Go for it." And so I did, and here I am. I never imagined myself getting out of bedside nursing and branching into education. I was pretty much set in the stereotype that that's what nurses do when they can't do nursing anymore. I was so wrong. Nurse educators are amazing. They really are. And by becoming one, I learned just how much of an impact nurse educators can have. Some of the key trends that nursing students are going to need to be well aware of is that nursing is moving out of the hospital and away from the bedside and more towards preventative medicine and prevention of illness. Nurses need to be great educators. They need to be able to go in and teach patients about their medications, their treatment plans, treatment options, things that maybe we weren't doing as much before. Nursing is going to be the forefront of healthcare. We're going to be the ones who are doing the patient education. We're going to be the front lines, doing a lot of home care, a lot of work in clinics to help keep people out of the hospital. In order for new grads to assimilate effectively into their new workplace, I think it is very important that you go in like a sponge. You want to soak up every drop of knowledge that your more experienced colleagues have to offer. You want to be open. You want to listen to their advice, even if you think you already know it. Take that again as a learning moment. Every moment you're learning. Learn what this person has to say about it. Look at it from their point of view, a new perspective. Perhaps it's particular to that hospital's policy, and that's something that you're not going to get in nursing school. We can't possibly teach you every hospital's policy. So be prepared, just be open. Find a mentor, somebody who will precept you, who takes you under their wing, who watches out for you, who wants to be there for you and help you with some of the emotional highs and lows that you're going to experience as a nurse. I still stay in contact with my mentor from my very first nursing job. So speaking to those experienced nurses out there who are already working, who are very seasoned, be excited for the new grads. You want them to learn the right way to do things. You want them to be excited about good patient care and good patient outcomes. Embrace them, bring them in. We've all been there, we've all been students. We all know how difficult it is and how hard it is. Let's break free from the culture of lateral violence and incivility. I don't like the thought that nurses eat their young. Nurses are caring, nurses are empathetic, we're compassionate, we're embracing, we love each other. So let's show that in our relationship with students when they come into the new practice area.
Thank you for joining us today. Click the banner below this video player to share your ideas and suggestions for Nursing Success TV. We'll see you next time!